So more greens, more beans, more nuts and seeds means you get calories from beans, greens, and nuts and seeds, means you eat less rice and potato and bread and cereals, and you eat less of that stuff, and pasta and oil and sweets. And as you eat less potato, and as you eat less of those things that are higher glycemic or lower in nutrients, this improves the glycemic load of your diet. It makes the glycemic load less, and it improves cardiovascular parameters, and makes you, of course, your cholesterol goes down, and your LDL cholesterol, the oxidized LDL, is the most dangerous LDL, and that gets wiped out. It doesn't just go down a little bit, it gets wiped out. With all these antioxidants, you don't have oxidized LDL. When you take a statin drug to lower your cholesterol, it doesn't wipe out your oxidized LDL. You still have a significant amount of oxidized LDL. A nutritarian diet lowers cholesterol as much or greater as a statin drug, but the difference is it streamlined the blood vessels. Remember, it activated the NRF2 transcription proteins with all those isothiocyanates. It lowered your blood pressure. It lowered your diabetic parameters. It made you lose weight. It wiped out oxidized LDL, and it lowered your cholesterol just as much as a statin drug, or more even. And half the people taking the statin drugs don't even want to take them anymore because they don't feel well after they take them. They make them feel fatigued, and they make them gain weight, and they make them lower their exercise tolerance. The medical profession overemphasizes the value of the statin drugs because they've never seen what can happen when a person eats so healthfully. They just think the only way to do it is with the statin drug. It's the only tools they have at their disposal. They don't have the years of experience seeing what can happen when you use nutritional excellence. Let's see what can happen for a minute, because here's a study on 440 people or so who followed a nutritarian diet for 6 months, and they dropped their blood pressure, their systolic blood pressure, by 26 points while they were decreasing and eliminating their drugs. This is significant. More blood pressure lowering than drugs, more cholesterol lowering than drugs, while the people are losing weight, and you're doing it naturally without putting toxins in your body. It's significant because when you're reversing blood pressure naturally, you're streamlining flow, you're removing plaque, you're restoring vascular elasticity, you're bringing more youthfulness and health back to the blood vessels. You're not just covering up the blood pressure with a drug. With a drug, it's just taking your high blood pressure and sweeping it under a rug. You're not lowering anybody's blood pressure. The blood vessels are still stiff. The plaque is still there. The aging of the tissues is still there. You just covered it up. You falsely covered it up. It's just like putting a blindfold on. You follow what I'm saying? When you lowered your blood pressure with a nutritarian diet, you reversed the pathology of the blood pressure. They didn't do that with the drug. You can't compare the drug use to the drug to what a nutritarian diet can do. And the people, the same study, the people that were lowering their blood pressure 26 points, dropped their weight 50 pounds at the same time. The drug didn't do that. The drug didn't lose 50 because the people who dropped 50 pounds to lower their blood pressure. You have to put this all together. You have to improve your diabetic parameters, lower your body weight, flood your body with nutrients. There's only one way to have excellent health. Here's Ronnie Valentine. He followed his doctor's advice, and he got bypass surgery. And then 4 years later, he had angioplasty. And then a few weeks later, he clogged up again, taking the drugs, on the statins, on the blood pressure medications, getting sicker and sicker like most people do. They don't get cured from their heart attacks. Most people with best medical care, still die for heart disease. They die of heart disease. If medical care was effective, they would be not dying of heart disease. Go to a cardiologist. People going to a cardiologist usually die of heart disease. Here's Ronnie with the most severe heart disease he could possibly have, and then he loses about 140 pounds in a year. Of course, we don't know if he weighed 300 pounds because his bathroom scale only went up to 300 pounds. Maybe he was 310, who knows? But look at his blood pressure on medication. Look at his blood pressure 1 year later on no medication. Look at his cholesterol on Lipitor 20. Look at his LDL of 148 on Lipitor 20. Wow. And look at his cholesterol on no medication, no cholesterol-lowering drug. We take these people off their cholesterol-lowering drugs, and they lose weight more effectively, and they reverse their heart disease faster, not slower, faster. They're dropping weight faster, they get their weight down faster, their blood pressure drops. And this saved his life. He was going to be he was sent home to die with because he couldn't even move with his chest pain. You know, just this week, I see patients like this every day. Just this September, I saw 2 guys who came into my facility, both with unstable angina. They should have been rushed to the hospital, having chest pain at rest. These guys come in like 150 pounds overweight, having chest pain. I'm saying, what are you doing here? Why don't you go to the hospital? You know, because you're going to die of a heart attack. They say, I'm not going to a hospital. I don't care if I die. I'm not putting a stent in. I'm not going to a hospital. These are people I see. So both of these guys, just this last couple months ago, the first guy, Dave, he loses 50 pounds in the first 2 months. Of course, in the first 2 months, when he loses the 50 pounds, where he couldn't even walk a little bit without chest pain, popping nitroglycerin, his chest pains are gone. Walking around, walking hills, running around the place, feeling great. The month after he leaves, he loses another 20 pounds after he leaves me. And I'm following up on him. He's continuing to lose weight and get healthier and healthier. Really, the transformations are miraculous. The most severe people get well, even from severe disease. And nobody's treating people this way. Here's a guy, John, who was my patient in 1994 when he was 72. Now he's 98. Wow, can't even get these people to die. He had triple vessel disease, told by his cardiologist because due to the abnormal stress test, he needed an urgent angiogram and stent placement. And I said to him, you know, it's not urgent, you're not unstable. Give me a few months. This is before I wrote a book. Right? You know, people just thought I was crazy back then. Write a book, they don't think you're as crazy because at least it's written down in the book. They can see that, you know. So he goes back to his cardiologist 3 months later, and his stress test now is dramatically improved. And the cardiologist says, wow, it's unbelievable, you're getting better. It's like almost gone. You know, well, that's great. What Dr. Fuhrman's doing is wonderful. Just keep doing it. You don't need to go further then. And he said, I've never seen any of this happen before in my whole life. Cardiologists don't see this. They don't really see the natural history of disease getting worse or getting better. They only see what happens when you give drugs, so their opinions are very colored. You know, they're colored because if people keep eating the same diet that caused the problem to begin with. They're not seeing the natural history of heart disease when people are eating a healthy diet. Because almost nobody eats a nutritarian diet that's rich in green vegetables and beans, that's low glycemically favorable, that's nutrient rich. Nobody's eating this way. The point I'm bringing up John is that he was on blood pressure medications back then. And as he got older, and after his chest pains went away, his blood pressure went down even when he was off the blood pressure medications. Let me say that one more time, that when we stopped the blood pressure medications, and his blood pressure was now borderline high on no medication, as he got older, his blood pressure improved more and more. The longer he was on the diet, the better his blood pressure got, even as he aged. It's not aging that raises your blood pressure. Water runs off a waterfall and hits a rock at the base of the cliff, and the water rips the rock and ages it and rips it in two and puts a hole right in the middle of the rock. But the rock didn't age. Water hit it day after day. You follow what I'm saying right now? It's amazing to watch these patients of mine, even when they're elderly, to watch them getting better and their heart disease reversing, their blood pressure dropping, which is so exciting to see, whereas statins can have potentially serious side effects because they make you gain weight, they can cause liver damage. Sure, just because statins might be better for a person eating an American diet to lower their cholesterol if they're not doing it, but you can't compare the effect and take those risks, including increasing breast cancer, risk of invasive breast cancer, and preventing you from losing weight. On a nutritarian diet, why would I maintain the statin if it's slowing down the person getting the fat off the body? Because you have fat on the interior wall of your blood vessels and fat on the exterior wall of your blood vessels too, the visceral fat, restricting the excursion of the blood vessels moving in both directions. My experience, because I'm doing this for 30 years with thousands of patients with heart disease, this has been my life's work to take these advanced patients with really sick and watching them get well. As a busy doctor seeing people all day long with these problems. And in all these cases, they get better and their heart disease reverses, and I don't need to give them statin drugs to see that happen. As a matter of fact, their disease reversal is accelerated because I don't give them the statin drugs. And muscle damage is occurring just because there's no evidence of it. and you don't see the liver function being destroyed, or you're not feeling the weakness or the pain, doesn't mean imperceptible muscle damage isn't occurring year after year, and that muscle damage may include damage to the heart muscle too. These drugs are not without serious risks. And why incur that risk when a nutritarian diet is so incredibly effective in every case?